Solitary thyroid nodule. A patient has been sent to you by her primary care doctor for a recently discovered solitary right thyroid nodule that was discovered on an exam and confirmed with ultrasound. Now let's chart the note for this new patient. The chief complaint can be selected from our master list. For commonly encountered complaints, charting with a template helps to ensure that all historical items are charted. I'll select the thyroid nodule initial evaluation. After the templated items are charted, you can elaborate on any other pertinent history. Now let's chart the review of systems. This patient has no other complaints other than the thyroid nodule, so I'll click the Normal Review of Systems button. Each provider can customize their terms and which systems to include in a normal review of systems. We can chart the previous medical history in the Histories and Habits section. This patient has already entered information through the patient portal that now just needs to be reviewed and confirmed. There are several means for patients to enter and update their history without the provider needing to transcribe each change. After I've confirmed the previous history, I'll click Review All to document the review. Also charted are surgery history and family history. Immunization and social history are also seen here. When family history is important to the disease condition, you can enter not only pertinent positives, but also pertinent negatives. Here I am documenting that there is no family history of thyroid nodules or hyperthyroidism in the patient's parents or siblings. Now let's review the patient's medications. First, I'll reconcile that the medications the patient has already reported being on are in fact being used by the patient. Now let's chart the exam. The only abnormal finding was the thyroid nodule. If the remainder of the exam is normal, we can just click the Normal unless otherwise specified button to indicate the normal findings. Now I'll chart my assessment. solitary thyroid nodule, which will chart the appropriate diagnosis code. We see a default plan already entered based on the problem, which includes an ultrasound-guided fine needle aspiration biopsy, TSH level, and patient counseling. I'll elaborate on my assessment. Let's follow up for 2 weeks. For certain conditions, there may be patient counseling information linked to the diagnosis. This information can be viewed and printed either during the encounter or at checkout. The E&M coding checker can let you know if your note requires certain elements to code at the appropriate level. Finally, let's enter the ordered tests for this patient. To create a practice panel that includes a series of tests within one order. In this case, I ordered a TSH and ultrasound-guided fine needle aspiration biopsy. Lab Solutions has bidirectional lab connections to all the major reference labs. You can also print off the requisition and hand it to the patient. Now let's take a look at the note we just charted. Here we see the history. Here is the review of systems. Physical exam with the abnormal findings highlighted in red for easy viewing. The assessment and plan, and ordered test. Acceptable, you can now sign the note. The note can be faxed with a cover letter or a pre-formatted consult letter to the referring doctor. This primary medical doctor has already been matched based on our master list of physicians with their fax. Click Send Fax and the note and cover letter are automatically sent. When the TSH lab test is returned, it can be viewed from within the encounter note or through the Waiting Room Solutions order tracking queue. Return electronically for review and disposition. To a secure messaging portal where I can send the lab results along with the message.